Hello students, we will discuss about a condition which is again common, rather most important also as far as patient and you is considered. Look at that, what is this condition? See that left arm, there is a large tumor, quite big, maybe 20 to 30 centimeter size, with somewhere ulceration, necrosis, somewhere maybe fungation. You can see the dilated veins there, very large vascular tumor. So what is your diagnosis? I will just tell the history, maybe around 6 to 8 months duration, progressive, and of course patient has gone for a traditional local treatment rather than surgical side, and later of course when it becomes so much fungating, false millet, one patient landed to the surgical OP. So what is the probable diagnosis? First thing you think of is it is soft tissue sarcoma, left arm, STS, or osteosarcoma advanced, because once it is fixed everywhere, difficult to differentiate. Only biopsy will confirm the diagnosis. So it's very advanced soft tissue sarcoma, or one of the sarcoma as such. So it is STS, could be aggressive synovial sarcoma, or maybe undifferentiated pleomorphic sarcoma or liposarcoma, whatever the type. Synovial sarcoma is very aggressive, common in this region. Even undifferentiated pleomorphic sarcoma also common. Liposarcoma is the common, one of the commonest sarcoma. So one of these two things are quite common, possible. Synovial you have to keep in mind. UPS also you have to keep in mind. So how it is managed? Of course, examine properly, examine the lungs, examine abdomen, examine for the metastases, examine for the local lymph node involvement. Even the sarcomas are not commonly involved in lymph node. Few sarcomas involve lymph node, sometimes synovial sarcoma. So if you examine regional nodes, then examine systemic, very important to stage the disease. Then of course, it's very so advanced, it is definitely, if there is no systemic disease, it is a stage 3 disease. So incision biopsy or true cut, no FNAs, remember. Incision biopsy or true cut biopsy, you have to find out it's sarcoma, you have to do ISC, you have to do immunohistochemistry markers, you have to do PET-CT is most important, remember, to assess METs. In this patient, you have to do PET-CT, then stage the disease. GTNM staging you have to know properly. It's often asked in the MCQs, theory they will ask, Viva, if it's a short note, a short case is kept in the exam, they will ask in the Viva. Treatment is palliative hindquarter amputation, radiotherapy, you can't save this limb because fungating, foul smelling. So patient can't tolerate. So hindquarter amputation you have to do, radiotherapy, chemotherapy, of course. You got regimes, VAC regime, vincristine, adriamycin, cyclophosphamide. MAID regimes quite commonly used, remember, often asked in the MCQs. Mesna, adriamycin, ifosfamide, dacarbazine, remember MAID regime. Of course, this is a very common main question asked in the theory. Small different sarcomas may be asked the short note. Staging of GTNM staging may be short note, or MCQs, different detailed subdivisions are there. That may be short note, so you have to know about those things and how to manage. Remember, no incision biopsy, true cut, or no FNAC, true cut or incision biopsy is the method of diagnosis histologically. CT, MRI of the area, CT, and of course PET-CT when you think it is advanced. So this is the different investigation treatment I have already discussed. So please go through my clinical methods in surgery, manual surgery for detail, operative surgery, and my DigiNow lectures covers everything as for CBME. So students, I hope you understood sarcoma very well. Please go through it eventually. Thank you very much.